My goals as incoming chair of ANZGOG is to continue our core activity, which is to conduct insightful clinical trials for women with gynecological cancers. Our consumers at ANZGOG are part of our core membership. They have the ability to bring their expertise and experience to our trials and all aspects of our activities. The power of translation and adding precious translational samples to our trials means that we can answer questions and make sure that we really understand how a drug works and which patients should receive that drug for their cancer. If we don't do that, we're missing priceless opportunities and wasting precious time for our patients. More than half of gynecological cancers are rare, and rare cancer patients don't have the availability of drug access because no one's been able to study their particular rare cancer in enough detail. By collecting translational samples, particularly of rare cancers, we have the ability to study those cancers in more detail. That's the only way we're going to be able to access drugs for patients who have truly rare cancers, by studying samples from their cancer. Thinking about stakeholders is really important to me. Collaborating with people means that we have more power in everything we do. Stakeholders are really important to ANZGOG, and there are all sorts of different types. We have health, we have science, we have community, and we need to bring the community with us in every way we possibly can. So thinking really broadly about everyone who's here to help us solve this problem of gynecological cancer is something we're going to do even more deeply as we go forward. We've been able to move forward with small, smart, nimble trials based on the best science and ensuring that we have access to translational samples after the trial is completed. That's the way we want to move forward with ANZGOG trials. ANZGOG has been increasingly supporting investigators by having a broader base for concept initiation, for supporting investigators with a new fellow on board, and for teaching investigators how to write grants and to submit trial designs. This is all intent on sponsoring trials and supporting successful grant applications, leading to independent investigator-driven trials. ANZGOG has achieved so much in the last 4 years, growing to an organisation that can independently sponsor clinical trials and really support particularly junior investigators to get to the point where they can independently submit and be successful in running clinical trials. This would not have been possible without the calm and expert leadership and stewardship of both Philip Beale and Alison Evans and all of their operational staff. And I'm really grateful to all of you for this.